Suggested title: After 60. Try these 5 simple exercises to support better leg circulation. 30-second hook. If your legs feel heavy, cold, swollen, tired, or weak after 60, it can be tempting to blame it all on aging. But sometimes your legs are asking for better movement, better muscle activation, and better circulation support. Walking is helpful, but for many seniors, walking alone may not wake up all the muscles that help move blood through the lower legs. In this video, we will go through 5 simple exercises that may help support circulation, leg strength, balance, and daily mobility. Stay until the end, because the final movement is powerful, but it must be done safely. Full rewritten script. If you're over 60 and your legs sometimes feel heavy, tired, cold, swollen, or less steady than they used to, you are not alone. Many older adults notice these changes slowly. At first, it may be something small. Your feet feel colder at night. Your calves cramp more often. Your legs feel heavy when you stand up from a chair. Your ankles look more swollen by the evening. Or you feel a strange tingling or numbness that seems to come and go. A lot of people brush these signs off and say, "Well, I guess this is just aging." But that is not always the full story. As we get older, our blood vessels can become less flexible. Muscles may lose strength. Sitting for long periods can slow the natural pumping action in the legs. And when the calves, ankles, thighs, and hips are not moving enough, blood can have a harder time traveling back up toward the heart. That does not mean you should panic, and it does not mean one exercise will cure every circulation problem. But it does mean that the right kind of gentle movement can matter. Your leg muscles are more than just muscles. They help you stand, they help you walk, they help you balance, and they also help move blood through the lower body. This is why many health professionals call the calf muscles a kind of second heart for the legs. Every time your calf contracts, it helps squeeze blood upward against gravity. Walking is a good habit for many seniors, and it can support overall health. But walking may not always be enough by itself, especially if your ankles, calves, shins, thighs, or balance muscles are not being challenged in different ways. That is why today we are going to talk about 5 simple exercises that may help support better leg circulation after 60. These exercises are not meant to replace medical care. They are not a cure for peripheral artery disease, vein disease, diabetes complications, neuropathy, blood clots, or any serious condition. They are simple movements that may help wake up the muscles that support blood flow, leg strength, and mobility. Before we begin, please remember this important disclaimer. This video is for educational purposes only and is not medical advice. Talk to your doctor, physical therapist, or qualified healthcare professional before starting any new exercise routine, especially if you have heart disease, poor circulation, diabetes, neuropathy, dizziness, balance problems, swelling in leg wounds, severe pain, recent surgery, or if you take blood thinners or other prescription medications. Also seek medical help right away if you have sudden leg pain, one-sided swelling, redness, warmth, chest pain, shortness of breath, sudden weakness, or new numbness. Those can be warning signs that need urgent care. Now, if your doctor says gentle movement is safe for you, let's begin with exercise number 5. It looks simple, but it can be very useful because it activates one of the most important muscle groups for circulation. Exercise number 5. Standing heel raises with a gentle hold. The first exercise is the standing heel raise with a gentle hold. This movement may look easy, but it can be one of the most helpful exercises for waking up the calves. Your calf muscles sit at the back of your lower legs. These muscles work every time you stand, walk, climb stairs, or rise onto your toes. But they also play an important role in helping blood move upward from the legs. When your calf contracts, it squeezes the veins in your lower leg. This helps push blood back toward the heart. That is why many people notice that their legs feel worse after sitting still for too long. The calf pump has not been working enough. So the goal of this exercise is simple. Wake up the calf pump. Here is how to do it safely. Stand behind a sturdy chair next to a countertop or near a wall. Place one or both hands on the support. Keep your feet about hip width apart. Stand tall. Keep your shoulders relaxed. Now slowly rise up onto the balls of your feet. Do not bounce. Do not rush. Lift your heels slowly as if you are trying to grow taller. When you reach the top, Gently squeeze your calf muscles and hold for 1 or 2 seconds. Then slowly lower your heels back down. The lowering part matters too. Try not to drop your heels suddenly. Control the movement. A good starting point is 8 to 10 repetitions. If that feels easy and safe, you can slowly build up to 12 or 15 repetitions. You can do one set in the morning and one set later in the day, but always listen to your body. If you feel pain, dizziness, chest, discomfort, or unusual shortness of breath, stop and speak with a healthcare professional. For many seniors, this exercise fits easily into daily life. You can do it while waiting for coffee. You can do it while standing at the kitchen counter. You can do it after brushing your teeth. And because it does not require equipment, it is easy to practice consistently. The key is not to force it. The key is to make the movement smooth, steady, and repeatable. Over time, you may notice that your calves feel more awake. Your ankles may feel less stiff. Your legs may feel warmer after movement, and standing may feel a little more stable. If regular heel raises feel too hard, start with a smaller movement. You do not have to lift high. Even a small heel lift can begin to activate the calves. If you have balance concerns, keep both hands on a stable surface. If you have foot pain, severe arthritis, or neuropathy, ask a physical therapist how to modify this exercise for your body. Now, heel raises wake up the calves, but circulation in the legs also depends on the front of the lower leg, the knees, and the thighs. That brings us to exercise number 4, which can be done sitting down. Exercise number 4, seated leg extensions with ankle flexion. The next exercise is seated leg extensions with ankle flexion. This is a good option for seniors who spend a lot of time sitting or who need a low-impact movement that does not stress the joints. When you sit for long periods, blood can pool in the lower legs. The ankles may feel stiff. The feet may feel cold. The knees may feel weak when you stand. And the shins, which are the muscles along the front of the lower leg, may not get much use. This exercise helps bring several areas into the movement at once. It uses the thigh muscles. It uses the muscles around the knee. It uses the shin muscles. And it uses the ankle joint. Together, these areas can help create a gentle pumping action through the legs. Here is how to do it. Sit in a sturdy chair. Keep your back tall but relaxed. Place both feet flat on the floor. Hold the sides of the chair if you need support. Now slowly straighten one leg out in front of you. As the leg straightens, pull your toes back toward your shin. This is called ankle flexion. You should feel the front of your lower leg working. Hold the leg out for 2 or 3 seconds. Then lower the foot slowly back to the floor. Switch to the other side. Start with 8 repetitions per leg. If that feels comfortable, build up to 10 or 12 repetitions per leg. The most important thing is control. Do not swing the leg. Do not kick fast. Do not lock the knee hard. Move slowly, breathe normally, and focus on feeling the muscles work. This exercise can be especially helpful in the morning after long periods of sitting or during a TV break. It is also a good wake-up movement before standing and walking because it reminds the legs to participate. For people with arthritis, this may feel easier than standing exercises because the chair supports your body weight. But again, do not push through pain. If your knee hurts, reduce the range of motion. If your hip feels uncomfortable, lift the leg less. If your foot cramps, pause and gently relax the ankle. A simple routine could look like this. Right leg at slow repetitions. Left leg 8 slow repetitions. Rest for a moment. Then repeat one more time if you feel safe. Some people like to add a gentle ankle circle after each set. That can be helpful too. Move your ankle slowly in one direction, then the other. This can help reduce stiffness in the foot and ankle. The reason this exercise matters is that circulation is not only about the heart, it is also about movement. When you move the muscles of the legs, you help support the natural flow of blood and fluid. Small movements done consistently can be more useful than one intense session done once in a while. Now we have activated the calves, shins, knees, and thighs in a safe seated position. Next, we are going to look at a stronger movement that uses the thighs and calves together. This one can be powerful, but it must be modified carefully for each person. Exercise number 3, wall. Sit with gentle calf pulses. Exercise number 3 is the wall sit with gentle calf pulses. This exercise combines 2 ideas. First, the wall sit activates the thighs and hips. Second, the calf pulses activate the lower legs. Together, they can help challenge the legs in a different way than normal walking. But this exercise is not for everyone. If you have knee pain, hip pain, severe arthritis, dizziness, poor balance, or have been told to avoid squatting movements, skip this exercise or ask a physical therapist for a safer version. For many seniors, a full wall sit is too much at first. That is completely okay. You do not need to slide down low. You do not need to make your thighs parallel to the floor. You do not need to hold it for a long time. A small bend in the knees can be enough. Here is the safe beginner version. Stand with your back against a wall. Place your feet about 1 to 2 feet away from the wall. Keep your feet hip-width apart. Slowly slide down just a little bit, bending your knees slightly. Your knees should stay in line with your toes. Do not let your knees collapse inward. Do not go so low that you feel knee pain. Now hold that gentle position. While you are there, slowly lift your heels a little, then lower them. These are the calf pulses. They should be small, controlled, and comfortable. Try 5 to 8 gentle pulses, then stand back up and rest. That is one set. If it feels good, you may do 1 or 2 sets. Do not rush. Do not try to prove anything. The goal is to wake up the legs, not exhaust them. This exercise can make the thighs burn quickly because the muscles are holding your body in place. That is normal to a point, but sharp pain, joint pain, dizziness, or breathlessness are not things to ignore. Stop if something feels wrong. One reason this movement is useful is that it asks the legs to work together. The thighs help support the knees and hips. The calves help support the ankles and lower leg pump, and the body learns to maintain posture while the lower legs move. That combination can be helpful for daily tasks, like standing at the sink, waiting in line, getting up from a chair, or walking across a room. If the wall sit version is too difficult, you can make it much easier. Simply stand facing a countertop. Hold the counter. Bend your knees slightly. Then perform small heel raises. This gives you a similar idea with less pressure. For some seniors, that is the better starting point. Remember, the best exercise is not the hardest one. The best exercise is the one you can do safely and consistently. Now, the next movement is different because you do it lying down. This can be helpful for people who feel heavy legs in the morning, or who want a gentle way to move the legs without loading the knees and hips. Exercise number 2. Lying leg cycling with easy intervals. Exercise number 2 is lying leg cycling with easy intervals. You may have seen this movement before. You lie on your back and move your legs as if you are riding a bicycle in the air. It is simple, but it can be a very effective way to move the hips, knees, ankles, and thighs together. Because you are lying down, this exercise places very little weight on the joints. That can make it a useful option for some people with knee discomfort, or those who do not tolerate standing movements well. But it still requires core control and hip movement, so begin gently. Here is how to do it. Lie on your back, on a firm but comfortable surface, such as a carpet mat or bed, if getting on the floor is not safe for you. If you use a bed, make sure you are stable and not near the edge. Place your hands at your sides. Keep your lower back comfortable. Now lift one leg at a time and begin a slow cycling motion. You do not need to make big circles at first. Start small. Move slowly. Breathe normally. Try 20 to 30 seconds of gentle cycling. Then rest. If that feels good, repeat 1 or 2 more times. For an interval version, try this. Cycle slowly for 20 seconds. Then cycle a little faster for 10 seconds. Then rest. The change in pace helps the muscles work in different ways. But do not go so fast that you lose control. This should not feel like a race. It should feel like smooth, steady movement. If both legs in the air feels too hard, modify it. Keep one foot on the floor or bed while the other leg moves. Then switch sides. This is still useful. If your hip flexors cramp, take a break. If your back arches or hurts, reduce the movement, or place a pillow under your head and shoulders. If lying flat makes you dizzy or short of breath, stop and speak with a healthcare professional. Some seniors like to do this exercise in the morning before getting out of bed. That can be helpful because it gently wakes up the legs before standing. But do not rush from lying down to standing. After finishing, sit on the edge of the bed for a moment. Let your body adjust. Then stand slowly. This is especially important if you feel lightheaded when standing. The reason lying leg cycling may help is simple. It moves the legs through a repeated pattern. It activates the thighs, hips, and lower legs. It encourages the ankles to move, and it can help the legs feel less stiff before daily activity. Again, we are not calling it a cure. We are calling it a practical movement tool. Now, the final exercise is the one that can be very effective for coordination, balance, and leg activation. But it is also the one that needs the most caution. So please listen carefully to the safety instructions. Exercise number 1. Safe backward walking with support. Exercise number 1 is safe backward walking with support. Backward walking has become popular because it uses the legs differently than normal walking. When you walk forward, your body uses familiar patterns. But when you walk backward, your calves, thighs, hamstrings, glutes, feet, and balance system all have to pay closer attention. This can be helpful for coordination, leg strength, and balance practice. But for senior, safety comes first. Do not walk backward in an open space unless you are steady and confident. Do not do this near stairs, rugs, pets, clutter, or slippery floors. Do not do it if you feel dizzy, unstable, or have a high risk of falling. The safest version is to do it next to a long countertop, a hallway wall, or with another person nearby. Here is the beginner version. Stand next to a wall or countertop. Place one hand lightly on the support. Stand tall. Look straight ahead if possible. Now take one slow step backward. Place the toes down first, then gently lower the heel. Then take another slow step backward. Move carefully. Do not rush. Take 5 to 10 steps backward, then stop. Turn around safely or walk forward back to your starting point. Rest for a moment. Repeat 1 or 2 times if you feel steady. That is enough for a beginner. You do not need to do 20 steps right away. You do not need to add 2 touches right away. You do not need to make this difficult. For many seniors, backward walking alone is already a meaningful challenge. Once you are comfortable, you can add a simple pause after each round. Instead of toe touches, which can be risky for some people with back problems or dizziness, try a safer option. Stand tall. Hold the wall or counter. Gently lift your toes up and down 5 times, or gently march in place 5 times. This keeps the focus on circulation and leg activation without forcing your back into a deep forward bend. If you are very flexible and your doctor or therapist says toe touches are safe for you, you may do a gentle forward reach. But never bounce. Never force your spine. Never lower your head quickly if you get dizzy. Backward walking can be useful because it trains muscles and coordination in a different direction. It asks the brain and body to communicate more carefully. It also activates the muscles around the knees and hips in a way that normal forward walking may not. This is why some physical therapists use backward stepping or backward walking in controlled settings. But again, controlled is the important word. Do it slowly. Do it safely. Use support. And stop if you feel unsure. For a simple routine, try this. 5 slow backward steps. Pause. 5 gentle toe lifts or marches. Rest. Repeat 2 rounds. That may be all you need at first. As you improve, you can add more steps or more rounds. But quality matters more than quantity. Your goal is not to move like an athlete. Your goal is to help your legs stay responsive, steady, and useful in everyday life. How to combine the 5 exercises safely. Now that we have covered all 5 exercises, let's talk about how to use them. You do not need to do all of them every day. You do not need to do them perfectly. And you definitely do not need to push through pain. A safe beginner routine might look like this. First, seated leg extensions with ankle flexion for 1 minute. Second, standing heel raises for 8 to 10 repetitions. Third, a modified wall sit with a few gentle calf pulses only if it feels safe. Fourth, lying leg cycling for 20 to 30 seconds. Fifth, supported backward walking for a few slow steps. That is a complete leg circulation support routine. It may take only 5 to 10 minutes, and for many seniors, that is a realistic starting point. You can do it in the morning to wake up the legs, or you can do parts of it after sitting for a long time. For example, after watching television, you might do seated leg extensions. After standing at the kitchen counter, you might do heel raises. Before walking outside, you might do gentle ankle flexion. The goal is to add movement into your day in a way your body can accept. Consistency is more important than intensity. A small, safe routine done regularly is better than a hard routine you quit after 2 days. Also, pay attention to how your legs respond. Do they feel warmer? Do they feel lighter? Do you feel more stable when standing? Then you move with a little more confidence. Those are the kinds of changes many people hope to notice. But if symptoms get worse, if one leg swells more than the other, if you have new pain, or if your feet change color, do not ignore it. Talk to your doctor. Circulation problems can be serious, and exercise is only one part of the picture. Other factors also matter. Hydration matters. Smoking status matters. Blood sugar matters. Blood pressure matters. Cholesterol matters. Medication management matters. Foot care matters. And regular medical checkups matter. So think of these exercises as support, not a substitute for care. Why these movements may help after 60. The reason these 5 exercises work well together is that they target different parts of the lower body. Heel raises focus on the calves. Seated leg extensions help the thighs and shins. Wall sits challenge the thighs and calves together. Lying leg cycling moves the hips, knees, and ankles without much joint loading. Backward walking trains coordination, balance, and muscles that may not be used much during regular walking. Together they create variety, and variety matters. The body adapts to what it does repeatedly. If you only sit, the body becomes good at sitting. If you only walk forward slowly, some muscles may still remain underused. But when you gently add calf work, ankle work, thigh work, hip movement, and balance practice, you give the legs a broader message. Stay awake, stay strong, stay responsive, keep helping me move. That is the real purpose of this routine. Not perfection, not extreme exercise, not chasing miracle results, just helping your legs stay involved in your life. Closing message. If you are over 60 and you are dealing with heavy legs, cold feet, stiffness, weakness, or reduced confidence when walking, do not ignore those signs. They are worth paying attention to. Talk to your doctor, especially if the symptoms are new, worsening, painful, or one-sided. But if you have been cleared for gentle movement, these 5 exercises can be a practical place to begin. Start with 1. Maybe today you try standing heel raises at the kitchen counter. Maybe tomorrow you try seated leg extensions while watching television. Maybe later this week you try lying leg cycling before getting out of bed. And when you feel ready and safe, you may add supported backward walking. Small steps matter, because independence is not built in one dramatic moment. It is built through the small things you repeat every day. 1 heel raise, 1 seated leg extension, 1 gentle wall sit, 1 slow cycling motion, 1 careful backward step. Over time, those small actions can help you feel more connected to your legs and more confident in your movement. So here is my question for you. Which of these 5 exercises will you try first? Will it be heel raises, seated leg extensions, wall, sit pulses, lying leg, cycling, or supported backward walking? Type your answer in the comments below. And if you want more simple, safe, and practical health tips for seniors, please like this video, subscribe to the channel, and turn on the bell so you do not miss the next one. Remember, your legs are not just for walking. They are part of your freedom. Take care of them gently, move them wisely, and keep building strength one safe step at a time.